Hi everyone, my name is Alexia Chaparro, and today I'll be talking about the study that I read and wrote about titled The Therapeutic Process of Avatar Therapy. This was a study based on the dialogue between patients with schizophrenia and their avatars. The authors of the study are Melissa Boudoin, Stephanie Potvin, Alexandra Magalani, Laura Telazizo, Lissandra Bourguignon, Kingsada Praxavaillon, and Alexandra Dumas. So to start off with the topic, as we all know, those who suffer from a psychological disorder such as schizophrenia all share one main symptom, and that is hearing voices. The voices tend to be more of a negative impact than they are positive, making it hard to the person to live their everyday lives. These voices tend to say things to belittle the person, to offend them, discourage them, threaten them, just overall be a negative impact on this person. And the goal of the study is to see if the researchers would be able to manipulate those voices that are heard and turn them into more of a positive thing rather than a negative with the use of virtual reality technology. They turned these patients' voices into avatars that they would be able to see and interact with. The avatars would typically take the form of either someone that they knew, some kind of demon, just anything that this person would imagine this voice to be when they would hear them. And the person behind these avatars would be therapists that would navigate through the patient's emotions and conversations, and they would try to incorporate positive phrases throughout the sessions. And if not to make all of it positive or make them go away, another goal would be to help them to learn new techniques and new mechanisms to better handle and manage the voices they would hear. So this study had 18 participants, and I know that is a small number. I thought the very same thing. Each participant would receive 125 recorded sessions total. The therapist would begin each session, or at the beginning would begin more of like a negative approach to imitate what was already being experienced by the person before they started to incorporate more of the positive phrases. They would note from each session and they would see what the common phrases were used throughout each patient, and they began to make themes that were similar with different patients. Negatives were basically the ones that I initially mentioned, and throughout the sessions, new mechanisms were created to begin to try to make it all more positive. These included self-affirmation, counterattacks, reconciliation, empathetic listening, reinforcement, etc. All of these different mechanisms for the patient to be able to better come back to the voice and not just feel low from what the voices are saying. They would be able to better attack or defend themselves with these methods that they created. And from this study, they did find that overall they were getting more positive conclusions during the final sessions with each patient. They began to show a little more coming back and a little more jump back towards the voices that they would hear. And although the study was not getting rid of the voices altogether, the patients or participants walked away with a better understanding on how to better handle their voices on a day-to-day basis. Some of the critiques that I had for this study was, first of all, the small number of participants. As you saw, it definitely would have benefited a little more to have a bigger number to do the study on, as there are so many people in this world that could potentially suffer from schizophrenia or something similar to it. Genuine responses to the study. With this I mean with people knowing that they are being observed, or they know that they're part of a study. With the avatar, I'm not exactly sure if they knew that there was a therapist behind the avatar, but this would hold back any genuine responses, real genuine responses that they would typically answer normally to these voices that they would hear. Another one would be the age in the study. The average age within the study was between 40 to 50 years old. And that's another thing that I thought would have benefited if they included a bigger range of ages, as there could be younger people that also suffer from something like this at a early set on, and they would have benefited from something like this. This was the same with the ethnicity range, although they did have a good variety within these 18 participants. They definitely, in general, could have benefited a bigger range of number of participants and ethnicity within that. And that is the end of mine. So thank you for watching.